I chose psychiatry because I've always loved hearing stories, and whether that is all of the Harry Potter stories, one after another, constantly, or whether that's just sort of biographies, autobiographies. I love stories, and in psychiatry people tell you the most incredible stories. So it's kind of it's just the most interesting bit of medicine that you could ever do. I set up Extreme Psychiatry because I wanted to teach communication skills and teach medical students how to talk about mental health in a really positive, confident way. And it's a really safe learning environment, so people are able to make mistakes and they can ask really silly questions if that's what they think they are. There's no silly questions, but they can ask whatever they want and they've got a supportive team around them. It's no point only psychiatrists having this as their sort of special skill of I can talk about depression, I can talk about psychosis. At Extreme Psychiatry we're trying to teach all the medical students that we come across how to talk about mental health. Every week we do 3 role plays and one of them is a googly. So the 2 of them will be kind of general, you'd expect to see this in an exam, it's quite straightforward. And then the googly will be something that is much more about being a doctor and being in a real clinical situation where things aren't as safe as they are in the exam. I mean, if you had somebody with mania in an OSCE, that would be the only thing any of the students in the OSCE would be able to hear. So that very rarely gets examined by universities, but it's really important that medical students and junior doctors learn how to set boundaries, learn how to respectfully and politely make sure that they know where what is okay, what is not okay. Advice to medical students today, I think probably it's probably similar to what I wish somebody had told me ages ago, is that in A-levels you are being spoon-fed much more, and you come into university and people do kind of expect you to be a self-directed learner, which can mean that if you're not, you will start to think that maybe other people are getting teaching that you're not, or they're reading books that you're not, and actually it's that they're making teaching opportunities for themselves. So make your own learning opportunities, I think. And find some really good mentors, people that inspire you. One of the things I really love about psychiatry is that you don't have to be a particular type of person to be a psychiatrist. So if you want to have silly hair and you want to ride a motorbike and you want to be a little bit gay and you want to spend your time listening to people's stories, there's room for that, and that's kind of one of the best things about it. But if you want to wear a suit and you want to travel by tube and do things that I wouldn't want to do, then that's fine too. There's also room in psychiatry for that.